Today we will learn about gout. What is gout? Gout is disorder of urine metabolism, either overproduction or impaired excretion of uric acid, characterized by intermittent attack of acute arthritis produced by deposition of sodium urate crystal in joints. Primary hyperuricemia may be idiopathic or due to enzyme defect. Secondary hyperuricemia can occur in leukemia, chronic renal failure, and during drug therapy. Example: drugs are thiazide, loop diuretics, and pyrazinamide, levodopa, and cytotoxic agent as used in case of cancer. These drugs produce excess uric acid or produce the symptom of gout or aggravate the symptom of gout. Classification of gout is acute gout. Here we use mainly three classes of drugs: NSAIDs, non-steroidal anti-inflammatory drugs. Example: indomethacin, naproxen, diclofenac, piroxicam, sulfentec, and etoricoxib, colchicine, and glucocorticoid. Example: prednisolone, methylprednisolone, triamcinolone. For long-term control of gout or hyperuricemic condition, uricosuric agent probenecid, sulfenpyrazone can be used. Otherwise, uric acid synthesis inhibitor, allopurinol, fluvoxostate. Treatment of acute attack of gout. What is acute condition of gout? Is sudden severe attack of pain, redness, and swelling of joint. In case of acute gout, we use our first line drugs is non-steroid anti-inflammatory drugs. Example: naproxen, indomethacin, piroxicam, diclofenac, or etoricoxib. Colchicine, relieve pain in acute attack of gout, prevent release of chemotactic factor, and inhibit migration of neutrophil to affected area. This as it inhibits the migration of neutrophil, and thus it prevent further aggravation of inflammation and joint pain. This is a rapid acting type. Colchicine is a rapid acting, but it has adverse effect. This nausea, vomiting, diarrhea, and abdominal pain. But if it used for a long time, then it can cause myopathy, alopecia, aplastic, and agranulocytosis. This is third line or terminal drugs. In case of gout, acute gout, this produce rapid response and are reserved for cases not responding to NSAID and colchicine. Prednisolone, methylprednisolone, these given systematically, like IV route, we give this prednisolone or methylprednisolone, triamcinolone if given intra-articular if single joint is affected. Treatment for chronic gout. Uricosuric agent inhibit active tubular reabsorption and promote excretion. Means it prevents the absorption of uric acid from renal tubule, and it increase the excretion of uric acid and thus reduce the uric acid concentration in blood. This is a rapid acting but poorly tolerated. High fluid intake advised to prevent urate crystal formation in urine. Should not be given within 3 weeks of an acute attack because it promotes the mobilization of uric acid which deposited in the various parts, and it further aggravate the gouty condition. Example of uricosuric agent is probenecid, sulfenpyrazone. Adverse effect is GI toxicity and skin rashes. Contraindication in patient with renal failure. If patient have renal failure, then chances of deposition of urate crystal in urinary tract or renal system, which can damage the kidney. Drug interaction. Probenecid. If probenecid given with beta-lactam antibiotic, probenecid compete and block secretion of beta-lactam antibiotic, thus increase plasma level and treatment become more effective. If we use probenecid with beta-lactam, what happens? The efficacy of beta-lactam antibiotics increases as it probenecid prevents the excretion or secretion of beta-lactam through renal tubule and increase the concentration of plasma level of antibiotic. Thus, treatment become more effective. Allopurinol, which after getting metabolized in body, convert into alloxanthine. Alloxanthine is competitive inhibitor of xanthine oxidase. Xanthine oxidase which convert xanthine into hypoxanthine and hypoxanthine into uric acid. Thus it prevents formation of uric acid. It reduces urate crystal in kidney, joint and soft tissue. Excretion of xanthine and hypoxanthine in urine. Drug of choice of chronic gout is allopurinol. Adverse effect is hypersensitivity, Stevens-Johnson syndrome, GIT. GIT symptom: vomiting, diarrhea, occasional hepatotoxicity. Drug interaction: 6-markatopurine, when given with 6-markatopurine, it reduce the hyperuricemic condition, thus the dose of 6 markaptopuric, thus decrease the dose of 6 markaptopurine and its side effect. Fluvoxostate once daily dose orally, and it is xanthine oxidase inhibitor, decrease uric acid formation. Adverse effect is headache and hepatotoxicity. Diarrhea can be used in gout in patient who intolerant to allopurinol. Like in case of kidney disease patient, we can use fluvoxostate. Uricase urate oxidase produced by recombinant technology convert uric acid to soluble allantoin. Uric acid convert allantoin, which is soluble and get excreted in urine. Uricase promote this uric acid to conversion of uric acid into allantoin. Adverse effect of uricase is gastrointestinal disturbance like diarrhea, abdominal pain or vomiting. Hemolysis may also take place. Hypersensitivity. Pegloticase convert uric acid to allantoin, administered as IV infusion in case not responding to other drug. Adverse effect is anaphylaxis may occur. These are the drugs: thiazide, furosemide, pyrazinamide, and anti-cancer drug. These produce a hyperuricemic condition and produce the symptom like gout. This uric acid formation occurs by the metabolism of nucleic acid. Nucleic acid get converted into purine, and purine get hypoxanthine. Purine can get converted into xanthine, then hypoxanthine, then get converted to uric acid. Thanks for watching. Do like and subscribe my channel for further upcoming videos.